They transported me to Meriter ER.
I would say the ER experiences lined up with a lot of the stigmas at that point in time. Nurses, even doctors, like I felt like I was being discriminated against. They wouldn't allow any medications or anything. I was just a junkie, and I was just going to continue doing that even though I was 17, 18 years old. I wasn't even a person to anybody, is how it felt.
Stigma, for me, it was attached to a lot of shame, right? Like, you're bad, you're wrong, you're incorrect.
And it really takes a toll on one's self-esteem, you know, and even while interacting with teachers or people who are supposed to be either authority or role models in my life, when they have a negative attitude upon you as a child, I mean, it takes a toll.
You're a junkie. You're a loser. You're gonna end up dead. Those were the most hurtful things, especially when it came from family members.
They don't want to lie to you. They don't want to. They want to tell someone, but they're embarrassed. They have shame, and there's stigma. What can I do as an emergency physician? Say there's no place for that. I'm here for you. Just tell it to me straight. They're worried about people knowing they have an addiction. It's the stigma. The stigma's horrible, and the stigma's killing people.
We should be very careful how we look and talk about addiction, because there's a lot of stigma, a lot of negative attitudes and perceptions, and a lot of stereotyping. Well, in fact, addiction can affect anybody.
It's not anything that's wrong with the person from a moral standpoint. It's their body, it's the biologics, it's the chemistry of their body that's causing this to happen.
I think the biggest myth of addiction is simply that it's a moral failing, that people, for whatever reason, don't care and they're fine with being addicted to a substance, which is completely absurd. This is a brain disease. This is a real problem that people want help for.
Patients may be judged harshly or as drug-seeking, so it can be understandable that patients may not always want to be forthcoming about their struggles when it comes to substance use. And then, of course, as you might imagine, that becomes a vicious circle because patients feel compelled not to be completely truthful, and then healthcare providers identify those people as not being forthcoming about these issues and a challenge to deal with.
The faces of addiction that we see in the emergency department, I think we all have this picture in our head of what an addict looks like. It's somebody who lives in the inner city and they're homeless and they're dirty. But the truth is, it's everybody. I see young patients who are addicted to drugs. I see elderly patients who have heroin addictions.
Stigma plays, again, a huge role in driving the disease underground. I think addiction flourishes in the dark, and I think the stigma is one of the main things that keeps the lights off. If a patient comes in and they're taking pain medication, I don't necessarily. It's a little bit uncomfortable to broach a subject. Well, do you think maybe you've slipped from chronic pain into opioid use disorder? And that's a very, very fine line and very difficult to diagnose. And I think a lot of physicians really don't want to have to deal with that. There's this kind of misunderstanding that it's a fault, it's a character flaw, rather than it being a disease. If someone has diabetes, there's no stigma associated with using insulin. But for someone with opioid use disorder, a lot of times that was facilitated by doctors prescribing medications that maybe we shouldn't have been prescribing in a high of a dose. So we have to own the role that we had in this epidemic, but then there's this stigma associated with not wanting those patients in my office.
I think there needs to be more education in healthcare providers to educate them that this is a disease. You wouldn't think twice about caring for someone who's hyperglycemic because they forgot to pick up their insulin. You wouldn't think twice about someone whose blood pressure is really high because they ate ham for Easter. It's not, you don't think about it. There's no stigma with that. It doesn't register the same way as someone who repeatedly comes in for opiate or addiction-related issues. And so I think there needs to be more education with providers to help them understand that there shouldn't be a stigma, that addiction is a chronic disease just like any other chronic disease that requires support from the healthcare system.
Relapse happens in addiction. It's a natural part of the disease. And yes, people go to emergency rooms repeatedly with episodes of addiction. So do they with asthma. And when they go into the ER with asthma, what does the ER do? Oh my goodness, you can't breathe. Let's do something to help you breathe. And if you come in with addiction, it's like, what are you doing here? How did your treatment fail? Why are you sucking money out of the system? Why are you a social reprobate? The amount of stigma, the amount of antipathy toward people with this disease is profound. Addiction treatments for opioids that don't include medication-assisted treatment have much worse results than those where you do use medications. So using a drug to treat drug addiction, it sounds iconoclastic, it sounds revolutionary. You know, we're going to use a drug to treat drug addiction? Yes, we use drugs to treat drug addiction, thank you. It's a medical condition, thank you. It's a brain disease, thank you. And we have medications that can help. But you don't use them for a week or a month and go, hey, I just took care of a lifelong disease. It doesn't work that way.
It's a myth that I'm trying to overcome, that these therapies are just replacing one addiction for another. That's absolutely not true. Absolutely not true.
It is very important to offer treatment and engage in treatment pregnant women, because research clearly shows that outcomes of both the mother and her child will be much better with addiction treatment. For women who are pregnant and have addiction involving opioids, the use of medication-assisted treatment, and during pregnancy, it's typically either methadone or buprenorphine, will improve outcomes in both pregnancy outcomes, but also in mother's case.
There's also the stigma, I think, very important to understand is that from the patient's perspective, but there's a stigma definitely associated that makes people hide it until their lives are destroyed. And the path to destruction, you know, with alcohol, it may be decades, and with fentanyl or heroin can be one dose.
So the key element that we all need to promote is better access to addiction care, and making sure that a person feels empowered to seek help. Stigma of addiction creates the barrier. Shame of addiction create also a barrier, preventing people from asking for help and accessing treatment. If we approach it in this way, individuals who are affected by addiction are usually much more forthcoming to discuss it, to ask for help. Promoting the scientific fact that it is a treatable disease rather than a moral failure will help people overcome those misperceptions, shame, and seek out help.
Stigmatizing people is not okay. We are all people. We're supposed to be supporting these people and trying to get them help, and not putting them in the category where, oh, they're never going to amount to anything. Because look, I have credentials after my name now. I never thought that would happen, but it did.